I'm Dr. Sam Mann, and this is my podcast, Beyond Conventional Medical Thinking. The topic of today's podcast is about a best-selling medication that causes mental dullness, and neither doctors nor patients realize it. My specialty is hypertension. Over 100 million Americans have it. It's the commonest medical disorder. And the medication I'm going to be talking about is prescribed to many of those patients and also patients with various heart conditions. Over 15 million Americans are taking this drug. I can almost guarantee you know someone who's on it. So what's the problem? As a hypertension specialist, I have seen thousands of patients with hypertension, and something that's not that common. After seeing thousands of patients, you realize, hey, what is this that I'm seeing? And I noticed something that very few doctors have noticed, and it's really not in the literature very much. What's the problem? Mental dullness. This drug causes mental dullness. And when I say mental dullness, I mean one of about 4 types of mental dullness. On the mildest end is they feel less sharp than they used to. And unfortunately, we all feel less sharp than we used to after a certain age. But, and it may be from this medicine. It's hard to tell if it's the medicine or not, but that's the mildest form. And if you stop this medicine, maybe you'll feel better, maybe you won't. The next step would be mental dullness. Patients use that term. They just feel mentally dull when they don't understand it. And when I've had patients on this drug who describe that, the majority felt better after getting off that drug. The next one is mental fog. And again, this is a word patients use. They feel like they're in a fog and they don't understand it. And almost every patient I saw who had that, who was on this drug, responded and normalized when we stopped this drug and replaced it with another drug in the same category. And then finally, a confusional state, which can be confused with a degree of Alzheimer's disease. And that, of course, is a tragedy, particularly if it's caused by this. It's reversible, but nobody realizes it's a cause. And the nice thing about this is that there is a treatment. Stopping this drug and switching to a different drug in the same category. It's easy to do. It's safe. It's simple. It's inexpensive. And the results are quick. Within a day or two, the patient will know if it's helping or not. And that's why it is so tragic that nobody's aware of this, because it is so reversible. All right, what's the name of the drug? The name of the drug is metoprolol, otherwise known as Toprol, and it's used for hypertension and for certain heart issues. And joining me today is the daughter of a patient, Princella Johnson, who really illustrates the implications of this understanding. And she's here to join us and explain what she observed. And she was one of the patients in whom my observations led me to understand this. Welcome. Nice to see you.
Thank you.
Right. So I saw your mom about 10 years ago. And what had she experienced after she was given metoprolol?
She was experiencing dizziness, confusion, and she had extreme brain fog. She was not the person. She was not my mother that I saw a few days prior.
And how long had she been on the metoprolol when you saw her in that state?
She had been on the metoprolol 3 days.
Right. And then that's when you arranged the visit to see me. And the problem was her mental status. Did she know what day of the week it was, or month or year?
And that was my main concern. She had no idea what the day was, and she was having difficulties really identifying me.
Really?
Yes.
And this had been on for a few days. And then I saw her after she had been in this state for how long?
Approximately 3 days.
So I saw her around day number 4.
That's correct.
Right. And we discussed the metoprolol and we switched to a different beta blocker.
That's correct.
And then I saw her again in a couple of weeks or so. And what was your observation after she switched off the metoprolol and onto the other beta blocker?
My goodness, I had my mother back. She was the same. I had my mother. I didn't know who she was prior to that.
And how long did it take for that fogginess, the confusion to wear off once she got off the metoprolol?
It was within the next 24 hours. I noticed a difference.
Right. And it was important for me because if I had any doubt in my mind about what the metoprolol can do, what I was seeing and hearing convinced me that there's no way that the metoprolol was not the causative agent. And subsequently, I saw it in other patients as well, and it was important. And I'm grateful to you for bringing your mother to me and glad that I could help her. And we want to get that word out because it's a serious side effect and it is avoidable. People don't have to live with it forever. So I appreciate your coming on and joining me and helping in getting the word out.
Thank you for having me, Dr. Mann.
Thank you. So this medication, metoprolol, can cause confusion. Does anybody know that it can? And the answer is yes. If you look at the many different side effects listed at the bottom of the page with every drug, it does mention confusion. And there are a couple of studies that describe some confusion with this drug, metoprolol. So what causes it? And why is it this drug, which is a beta blocker, and what I prescribe is a different beta blocker and it solves the problem? What causes it? And I thought, well, is it that this drug penetrates and gives a higher drug level in the brain and the cerebrospinal fluid? And I thought that might be the answer, but I looked up the literature and I found that both with metoprolol and the drug that I will recommend as a replacement, the amount that gets into the spinal fluid and to the brain is about half the concentration of what the blood concentration is. But there was no difference between the two drugs. But there are two other factors that I strongly think explain this. One is with metoprolol. Metoprolol is metabolized by the liver, and it's genetically determined. Some people metabolize it rapidly and some very slowly. The rapid metabolizers, the problem is they don't get an adequate blood level for the drug to work. The opposite side, the slow metabolizers, get a very high concentration of the drug, much higher, and therefore the amount that gets into the brain is also increased. And I think that's the main reason. The other problem is that metoprolol blocks both what's called beta 1 and beta 2 receptors, and blocking beta 2 receptors in the brain can cause confusion. The other beta blocker does not block the beta 2 receptors. It's more purely a beta 1 receptor blocker, even at high levels. So those are the two main reasons. Now, the good news, again, as I said, is that the repair of this is just switching to the different beta blocker. But first, the patient and or the doctor have to be aware that the drug is a problem, is causing it. But I emphasize, I'm not suddenly stopping a beta blocker. I am switching to a different one. So there's no problem of withdrawal from the metoprolol because they're getting the new drug. So what is the other drug that I prescribe? It's called bisoprolol, bisoprolol, bisoprolol. And bisoprolol comes as a 5, 10, or 20 milligram pill. I almost never prescribe the 10 or 20. In most people, either 5 or even half of the 5, 2.5. So if you're a big guy, maybe you need 5. Otherwise, you could start with a half a pill. And if it's not and if the heart rate is a little faster, then go up to a whole pill. And again, it's not that this drug cures the problem. It's getting off the metoprolol. So even if you're on the wrong dose of this, getting off the metoprolol, you should see improvement, dramatic improvement within a day or two. So the bisoprolol gives you a much more predictable blood level. It's not subject to the metabolism problems that I just mentioned with metoprolol. And it's a very selective beta-1 blocker. So, and what percentage of patients will respond to taking away the metoprolol? My experience would suggest the loss of sharpness, some may respond, but for many, that's life. The mental dullness and the mental fog, a majority, most of patients do respond once the metoprolol is out of their system. And I've only seen a couple of patients where they were so confused that it mimicked Alzheimer's. Both patients responded. It's a very small sample, but if they're on metoprolol and there is a question of, well, they have Alzheimer's, there's no harm in switching them off the metoprolol. It's something that should be tried. Either it'll help or it won't help, but it's not going to harm. Now, there is one other beta blocker that I used to prescribe, betaxolol, which does what the bisoprolol does. They're very similar. I'm not recommending that for 2 reasons. One, a lot of pharmacies don't carry it. Number 2, the betaxolol, in a lot of patients, a quarter of a pill is enough, but a quarter of a pill is a big nuisance. Bisoprolol is the good drug here. So what's going to happen here with this finding? My first concern is that the data that I have is not enough to publish a scientific paper. To do a randomized controlled double-blind study, you're talking about recruiting hundreds and hundreds of patients with a ton of time, applying for grants for funding, applying for institutional review board approval, starting the study, having staff, having a statistician, publishing the article. It would take 2-3 years to get that done. 2, this is an old, inexpensive drug, and nobody's interested in looking at that. It is likely the study will never be done, but that makes it even more important for me to bring attention to it on this podcast. And again, I emphasize, if you're on metoprolol and you feel well, there's no need to stop it. And my guesstimate is that maybe 1 in 20 patients, 5%, have an effect like this. So again, if you're on metoprolol and you're feeling well, that's fine. But otherwise, it's safe and it's quick to try this alternative, and you'll know within a mere 2 days, 1 day, that it's worth trying. And I would suggest get the word out. I mean, send this podcast out to friends, to family, because I'm sure in every family there's somebody on metoprolol and their doctors and they are unaware that this is happening. And we got to get the word out because nobody's ever going to do the big study that would be required to bring attention to it. I would suggest another concern is nursing home patients. A lot of elderly patients, and this side effect is more frequent among elderly patients. A lot of elderly patients in nursing homes have a degree of what is assumed to be Alzheimer's. And possibly a significant number are on metoprolol. And I would think that anybody who is diagnosed with Alzheimer's and is on this drug, a trial of the other drug is absolutely necessary to avoid the tragedy of continuing like this because of a drug side effect that nobody's aware of. And in fact, I decided I was going to contact the nursing home, see what happened. So I called the nursing home. They never called me back. So then I went over and visited the nursing home, and I met with the nursing supervisor. She found it interesting. She would give my number to the doctor there. Never called me. I called the nursing supervisor again, and again she said she'll contact the doctor. He never contacted me. I'm not sure what to do at the next step, but yes, I want to bring attention. Anybody who knows nursing home personnel, bring this to their attention, and they can do what we call an N of 1 experiment. Take a couple of patients there who are on metoprolol and confused, stop it and see what happens. At least give them a try. Finally, I'm thinking of making, this could be a very new thing, but getting data from a podcast. So I'm asking you, if you're on metoprolol and you have these symptoms, talk to your doctor about switching to the other medication. And there's really no reason why he can't make the switch, other than he generally tends to prescribe metoprolol and is not familiar. But the bisoprolol is actually a superior drug, and it's worth, even if it's for 2-3 days, to try it. But what I'm going to ask you also, if you do this and try the other drug, I would ask you to send me a report. It helped or it didn't help. And you can do that by logging on to my website, drsamuelmann.com, clicking on the podcast icon, and then there's a space to put in the information and put in either it helped or it didn't help or it helped a little, and which type of mental dullness did you have of the 4 that I mentioned, and any other comments you wish. And if it didn't help, I want you equally, please send in the report and let's see what kind of results we get. And if there are enough numbers, I think we can introduce the podcast document as a way of conveying clinical research that cannot otherwise be funded. So that concludes this episode. Upcoming podcasts, one of them is about ADHD, attention deficit and hyperactivity disorder. There is treatment that is not great. My experience is there's another treatment that can be very helpful and has helped patients, and I'll discuss that. Another podcast episode coming up is about the mind-body connection, and there's been a half-century of mind-body research on anger, anxiety, relaxation techniques, and frankly, in hypertension, it led nowhere. And I'm going to be discussing a new and very different understanding of the mind-body connection that you don't find much of in the literature, and I guarantee you will find it fascinating. Also, if you have any questions about today's podcast, please feel free to send it to my website, podcast, and put in your question. We can do a Q&A that way, and I'll try to present it at the end of an upcoming podcast in those few minutes. Again, I invite you and your family and friends, please get the word out and ask if anybody else would like to subscribe. It's free, and there are a lot of issues I'd love to get the word out, and I need your help in getting the audience for that. Finally, other doctors may similarly have lessons from their clinical experience that I would love to convey on this. And if you know a doctor who feels that way, have them contact me on my website, drsamuelmann.com, podcast, and I'd love to present them and their findings on future podcast episodes. And then finally, a reminder of my book on the mind-body connection, Hidden Within Us, a radical new understanding of the mind-body connection. It's revolutionary and it's fascinating. Thank you.